This is Dr. Jerry Hesch. I work at Hesch Institute in Aurora, Colorado. And I treat the patient, and I treat joints throughout the body, and I treat the nervous system. And I wrote a book on the sacroiliac joint, which is 320 pages. And then I have two book chapters on the topic, a couple of articles, and I've taught workshops since 1985. This is a very rare presentation. My client has normal mobility if we do spring testing or end field testing in multiple directions. And that was inferior, and this is superior. I push up until it stops moving, and then I give it a little thrust of about 15 pounds, and normal structure will spring in that direction and recoil with integrity. Where she does not move is when I come on the PSIS and capture the ilium, and I'm springing in the plane of the joint, which parallels the outer plane of the ilium. I cannot get any load on that, and I'm pushing with 15 pounds of force, okay? The other thing we find is that the sacrum is perhaps a little more forward than usual. I'm not sure. Could be her norm, but if we change it, we'll pay attention to that. So for the moment, I'm going to say that's probably deeper than her norm, but we don't treat position, we treat movement. So I'm going to come on S2, S1, and S3 with the heel of my hand, and I'm trying to induce motion purely anteriorly into her body or towards the floor. I can't get any movement on that sacrum, and yet the sacrum does have some inferior glide motion. I saw her feet move because the force translated through the SI into the hips, into the knee, into the ankles. And now I'm going to spring inferiorly. And that's more of a test of the L5-S1 facets. And she has inferior glide mobility, but she just doesn't have pure anterior glide. And it's been so long since I've seen one of these. I estimate it to be 8 or 10 years ago. Very rare. But she did sustain a fall right onto her sacrum. And that happened twice?
Yes.
Okay. And those were pretty close to each other?
Yes, 1 year apart.
1 year apart?
Yeah.
Okay. Alrighty. And it's fair to say your pain is severe.
It is.
And it greatly impairs your ability to do normal things like standing and cooking.
Right.
Your husband had to help you. You went to a stretch place and they did stretching and you got worse. That was this week.
Yes.
And your husband had to help you get up to the bathroom.
Yes.
I mean, this is a serious impairment. So what I'm going to do, I just want to point out a couple of ligaments. So this is sacrotuberous ligament, which blends with the long dorsal sacroiliac ligament. It's a very powerful ligament. And then there's a lateral ligament that's covered up by the sacrotuberous ligament, and that's right here. Do you see this projection right in there? That is sacrospinous ligament. And these ligaments should have a little bit of give. And I describe it as a 3/8 inch rope being pulled very tight, where you can indent it a little bit. You can spring it, and it should go forward slightly, but bounce back with integrity. Okay. Well, I'm trying for the the long dorsal SI ligament, and it just feels really soft underneath the PSIS. But more than that, I trust the sacrotuberous ligament. If you make a triangle, you're almost on top of it. It's just slightly more medial. And so I come at an oblique approach and dig through the gluteals, and there it is. There's the ligament right there. It's distinct, okay? But I'm going to spring it now. I'm going to indent it, and I indented it, and it went further than I would expect. and now I spring it, nothing happens. It doesn't bounce back. And that's also true for the sacrospinous rather, the sacrospinous ligament on both sides. I just push into it, it just stays there. So I'm going to place foam on her ilium in the back at a 30-degree angle to capture the plane of the joint. I need to make sure those are not on the sacrum. I want those to be on the ilium. So it's going to look like this. Okay? Maybe it's a 25-degree angle. Who knows? All right, so let's have you lie on your back. Keep your knees bent. And then lift your pelvis up. Okay, so there's one. And here's another. And I'm going to then put about 3 pillows under your knees for comfort, okay?
Okay.
Can I slide these 2 under? And then I'll bring you one more.
Okay.
Here comes one more. All right.
Okay.
So I will stop filming, and then we will film the response to treatment.
Okay.